Right, so depolarizations are when both the activation gate is open as well as inactivation gate and the voltage reaches -55, perfect. Hyperpolarization is when the potential is lower than the resting membrane, resting weight of -70. Okay, so perfect, well said. The depolarizing event is going to be a positive change in the membrane potential. And some of the factors here are, again, well said. So it's going to happen at that threshold, -55. That's where you're going to start the depolarizing phase of the action potential. But even if we're not thinking about an action potential, we can have depolarization as a part of a graded potential as well. So really, it's just a positive change, an up change that's going closer to sodium's equilibrium potential relative to the resting weight. And then hyperpolarization would be the opposite, anything that's more negative from the resting weight. So when we think about these two terms, we really want to think about that -70, all right? Positive or negative change from that point. Question 2, if the permeability of a membrane to sodium increases, would the membrane depolarize or hyperpolarize? The permeability of a membrane to sodium increases, would the membrane depolarize or hyperpolarize? So going kind of back to the first question, this would be a depolarizing event, right? Remember, when we think about the movement of an ion, we think about its electrochemical driving force. For sodium, we describe that as being strongly into the cell. And so what that means is if we were to increase the permeability, in other words, open more channels for sodium, it would simply move according to that ECDF. So it would rush right into the cell. That would allow a positive change to the membrane potential. Instead of it being more negative inside the cell, it's now going to be more positive as that positively charged ion rushes into the cell. All right, so this would be a depolarizing event. If the membrane permeability, I'm going to switch this up for a bit just to show you the difference between sodium and potassium. If the membrane permeability for potassium were to increase, would this be a depolarizing or hyperpolarizing change? What do we think here if we swap this to be potassium? Excellent. This would be a hyperpolarizing event because, again, we think back to the ECDF of that ion, which happens to be out of the cell, right? And so if we were to open up additional channels for sodium, it would go out of the cell. That means positive charge would be leaving the cell, and that would make the membrane potential more negative or hyperpolarizing. All right, question 3, name the 3 gating mechanisms for ion channels. So what are the 3 types of mechanisms that we've described so far for an ion channel? What are the 3 types of mechanisms? Okay, excellent. So leak channel, ligand gated, voltage gated. All right, so this is somewhat correct. Ligand gated, definitely yes, something has to bind. Voltage gated, also definitely correct. Now, leak channels are not gated. So while it is a type of channel, it's not necessarily a gating mechanism if it's freely open, which we know them to be. Calcium channels are also not going to be gated. The third mechanism that we're looking for is a timed mechanism. All right, so a channel can be ligand gated, it can be voltage gated, it can also be time dependent. So that, in other words, that's the condition that has to be met before that channel can be opened up. All right, so those are the 3 types of mechanisms that we've described so far. Calcium channels are simply going to open up when the membrane potential gets to a certain voltage. So those can be considered voltage gated as well, and we'll talk about how. Ligand gated, something has to bind, and then time sensitive or time dependent, a certain time or amount of time has to pass. Okay, and for an example of that, when we talked about the inactivation gates on sodium channels, those would be both voltage and time dependent. Question 4, what is the threshold value for an action potential? Excellent, yeah, so negative 55. So again, this is a really easy point question. When you see this on the exam, this could be something that you have committed to memory. Negative 55 is our threshold value. Negative 70 is our resting value. Things like sodium's equilibrium potential of positive 60, potassium's equilibrium potential negative 94. Those should be 4 numbers that you have committed to memory. Those would be easy points on questions for your exam, okay? All right, so let's go ahead and keep going here. Now, what we're going to keep doing from this point onward is describing the action potential in a few different ways. So it's going to seem a little bit repetitive at this point. We're going to keep saying the same types of events, but we're going to describe them from different perspectives, just so you can really understand what's happening. So previously we talked about the gating mechanisms and how they result in depolarization, repolarization, hyperpolarization. We also talked about the permeability, how that is changing to result in different movement of the ions. Okay, and then we spoke about the way that this relates to negative feedback and positive feedback, right? Movement of sodium being negative feedback going away from, a positive feedback going away from set point, the movement of potassium being a negative feedback bringing us back to set point. So we're just going to keep describing the same events in a few different ways to give you a different perspective of the action potential. So the depolarization of the axon, as far as what's being illustrated here, is the opening up of our gates at negative 55, right, our threshold value, and then we have the rapid upstroke. Now we want to think about what's really happening in order to result in this rapid upstroke. This is where sodium is going into the cell. And just to keep reiterating this, sodium is going to move according to its ECDF if we open up more channels for it to do so. So as soon as we open up the activation gate and then subsequently the inactivation gate, the diffusion of sodium is allowed to happen. It's going to rush right into the cell, and that is going to result in this upstroke or the initial half of the action potential. Then we're going to get to the second half of the action potential, right? We're going to go all the way up to positive 30. So this can represent positive 30. It's the maximum point of the depolarization. Then we have a swap in the gating mechanisms. The activation gates, the inactivation gates on the sodium channels close, right, after that timed component. Now we have also at positive 30s a stimulus for the opening of the potassium channels. And so potassium is going to start leaving the cell. Again, think back to its ECDF, out of the cell. So as soon as we open up additional channels, potassium tries to leave the cell. And then the cell becomes less depolarized, in other words, repolarizing. In other words, a negative feedback event goes all the way down to negative 94. So we talked about the fact, or not negative 94, it tries to approach negative 94. In actuality, it gets down to about negative 80. And then after all the potassium channels have fully closed and no more potassium can leave the cell, then it can slowly recover and get back to rest. And the components that are required for that slow recovery are the sodium-potassium pump and the leak channels, which are always active. Those are the components that help to bring us back to negative 70. Okay. All right. Again, let's describe this in another way. Let's talk about the difference in permeabilities that's happening as these events take place. So we start out at rest, and at rest we know the permeability for potassium is greater than the permeability for sodium. In other words, more potassium is able to move, and so the resting membrane potential looks more like the the equilibrium potential for potassium. Okay, so that is to say that the membrane potential is very close to potassium's equilibrium potential. Right, and if you look at the action potential at the resting phase, notice that the blue line, which is potassium's permeability, potassium's equilibrium potential, right? Oh, excuse me. This is the permeability for potassium, excuse me. So the blue line represents the permeability for potassium. Notice that that is higher than the purple line, which is the permeability for sodium. So at rest, we start out at a place where potassium is the membrane is more permeable to potassium and less permeable to sodium. If we think about the depolarizing phase, those two events swap. The membrane is now more permeable for sodium, right? We can see this line going steeply up. And the membrane permeability for potassium is going to remain the same up until we get to this positive 30. So at this point, positive 30 is where we now have an increase in potassium's permeability as that voltage-gated potassium channel is now triggered at positive 30 to be opened. So when that opens, now the permeability for potassium can start to increase. In other words, potassium is leaving the cell at this point. And at the same time, the permeability for sodium is steeply decreasing, also owed to the gating mechanism on the sodium channels. So at this positive 30, we have two events occurring. Potassium's permeability starts to increase, and then sodium's permeability starts to decrease, and these two events together are what bring about the repolarization. Okay, and then towards the end of the action potential, we can see that potassium's permeability will eventually drop off, right, as we recover down and we overshoot the resting membrane potential. So notice the red curve, which is the action potential, right? That's going to overshoot the resting value. And the reason for that is because potassium is still moving. So notice the permeability for potassium here is still relatively high. And so we overshoot that resting membrane potential and go slightly more negative than negative 70. Okay. In the meantime, sodium's movement is completely halted, right? So all the sodium channels have now closed. And that is also going to encourage the repolarization as well. All right. Let's think about the graded potentials and how they are involved here. So in order for us to get to our depolarization, we need to have those smaller membrane potential changes that can help bring us closer to that negative 55. So that is why our graded potentials are so important. They're not meaningful, they're not sustainable, but they are the smaller units that are required to help get us to negative 55, and then we can fire an action potential. Okay. So let's talk about the regenerative mechanism of the action potential. So the rapid opening of sodium channels is the upstroke of the action potential. Then we have the slow closing of those channels. And then we also simultaneously have the opening of potassium channels. And then we have the resting or the decline, the repolarization of the membrane potential that gets us back to negative 70. All right. So the reason that the membrane potential does not get to positive 60, this is a really important concept to point out. Why doesn't the membrane potential actually get all the way up to positive 60? That is where sodium's equilibrium potential is. That is where the movement of sodium is at equilibrium, and that's where we're trying to get as sodium rushes into the cell, right? It's trying to get to equilibrium, which is positive 60. Why doesn't it actually ever get there? This is because potassium channels open up. So although we have sodium channels still open, two things happen at positive 30. The timed mechanism to close those channels, but also the opening up of potassium channels immediately starts to move the membrane potential in the opposite direction. Okay, so the sodium channels close, the potassium channels will then open up, and the potassium channels are going to stay open. Again, another sort of important distinction to make. They are not going to close when we get to -70. They're going to stay open beyond the -70 value. Potassium will continue to leave the cell. Again, as the membrane potential tries to get to potassium's equilibrium potential. And so there's going to be a hyperpolarization, which is overshooting the resting membrane potential or going more negative than the resting membrane potential. And that is because the potassium channels are still slightly open. Notice here, the permeability is not it hasn't dropped off yet. It's slowly declining, but there is still movement of potassium. And so the membrane potential is going to dip a little bit more negative than -70. And then as we said earlier, what helps to restore the resting membrane potential after all the potassium channels have closed? This would be the sodium-potassium pump. Remember, it's going to be pumping sodium out, potassium in, so it's going to sort of correct that hyperpolarization. It's going to correct that lower membrane potential value as it really just helps to push more potassium into the cell and help to somewhat increase that value, and then we're going to settle at -70. Okay. So really just kind of reiterating that the repolarization somewhat overshoots the resting membrane potential, right? We described that. It doesn't go down to -70 and just stop there. It actually goes a little bit lower, around 80 or 85 or so. And it doesn't reach potassium's equilibrium potential either. So it doesn't stop at -70, but it doesn't go all the way to -94. It sort of settles at a midpoint between those two values, so about -85, and then slowly, as the sodium-potassium pumps reestablish the resting value, we're going to see that level off to -70. All right, so what has to happen before this can recover is that all of the potassium channels need to be inactivated. They need to be closed first, and then the sodium-potassium pump can help get back to -70. Okay, now let's describe some of the features of the action potential. I talked about this when we looked at this on Monday, that the action potential is all or none. That's one of the governing principles of the action potential. It's either happening all the way fully or it's not at all. Either we have met the requirements of -55 and we fire a full and complete action potential, or we have not met those requirements and we do not initiate or fire an action potential. So that means it is all or nothing, all right? So when we get to the threshold value, a full action potential has to occur, right? There's no such thing as a half of a potential, half of an action potential. There's no such thing as a gradation or a grading of the potential. There's no such thing as a weak action potential or a strong action potential. That does not exist. An action potential is going to be all or nothing, right? Even if we have a weak stimulus, we're going to see the same degree of that action potential. If we have a middle or medium stimulus, we're going to see the same degree or magnitude of the membrane potential change. It's always going to go to +30 and always going to come back down. And again, if we have a strong stimulus, we're still going to see the exact same degree or type of action potential, right? So we can look at different requirements here. So let's say we have a sub-threshold depolarization. Let's say we have a greater potential that gets to let's say -60. We have not met threshold, so we're going to have no action potential. Not a half of it, not a quarter of it, just nothing. If we get to a supra threshold, let's say we have a greater potential that gets us way up to -40, right? Which is way more, way higher than our threshold. That is not going to give us a stronger action potential. The action potential is going to look the exact same as if we had a threshold or a graded potential that gets us exactly to threshold of -55. So there's no gradation or variation in the amplitude, in the duration, in the magnitude of an action potential. All right, and I think that's kind of the same principle that's being reiterated here as well. The size of the stimulus does not affect the action potential. It will always start at -55, peak at -30, recover at -85, and then go back to rest. So just to, again, illustrate that concept here, here's a very small graded potential. Here's a more, maybe a medium graded potential. And then here is a large graded potential, right? So both of these initial graded potentials can be considered sub-threshold stimuli. They are not enough of a change to get to -55. So they're both considered sub-threshold. And in both of these instances, we will not see an action potential. If we think about a threshold stimulus, this is a large graded potential, and it is enough to get us to -55, okay? So that is going to fire an action potential, and that's going to recover and go back to rest. If we took a supra-threshold stimulus, which is a really strong graded potential, let's say this was a -30, right? This is a change. This is a strong enough stimulus to get us to -40 or -30, which would be considered a supra-threshold stimulus. In other words, it's bigger than the -55 change. That is still going to result in the exact same action potential.